Bronx Journal, I'm Myra Scamella. The Bronx Smoke-Free Partnership is a health advocacy group that increases awareness of tobacco control issues in the Bronx among community members and policymakers. They partner with legislators, health advocates, and the Archdiocese of New York Drug Abuse Prevention Program. They support neighborhood-based efforts for effective and long-term change throughout the borough of the Bronx. Joining us today to talk more about the Smoke-Free Advocacy Group is David Lehman, Borough Coordinator for the Bronx Smoke-Free Partnership, Counselor Teresa Esposito, and students Dante Natoli and Angelo Salvatico. Welcome to the show, guys. Okay. All right, so tell us more about the Bronx Free Smoke and the ADAP. What started this partnership?
Well, the Bronx Smoke-Free Partnership is one of 5 partnerships in the 5 boroughs of New York. Our partnership was founded in May of 2010 with the borough president, and we are part of the Coalition for a Smoke-Free City, which is an organization that was formed in 2001, and we got a grant from the state in 2010 to form a partnership in each of the 5 boroughs. And the overall goal of our partnership is very ambitious, but we're the Bronx Smoke-Free Partnership, and our goal is to eventually see a smoke-free Bronx, and we've made a lot of progress. Tobacco use is still the #1 preventable cause of death and disease in our borough, in our city, in our country, and our goal is to make the Bronx smoke-free one day. Okay, and so far, what is the greatest accomplishment that has occurred recently? Well, I mean, if you'll allow me to go back just a little bit, I think everybody will identify with what happened in 2002 when the smoke-free workplace law passed, and because bars and restaurants were considered workplaces, all the bars and restaurants in New York City in 2002 became smoke-free. So I think most New Yorkers are enjoying the benefits of that, being able to go to restaurants and bars and not have to inhale secondhand smoke, which is a Class A carcinogen. Then last year, one of the things that we did to try to denormalize tobacco use, let people see tobacco being used less places so that our youth don't see people smoking all over the borough of the Bronx, we passed smoke-free parks and beaches. So last summer, our parks and beaches, which the Bronx has more parks and beaches than any other borough, and our parks and beaches became smoke-free last year. So a lot of major accomplishments toward our goal of a smoke-free Bronx. And how was it possible to accomplish a smoke-free environment in apartments and condos? That's just, we're just beginning to educate people in the Bronx about the advantages of it. 85% of people don't smoke, and so 67% of people say that they would love to live in a smoke-free building, but I think most people don't see that as an opportunity yet. So we're just beginning to educate landlords and policymakers and others about the advantages of smoke-free living, but we're definitely not going for any policies there now. It's all just education that we're doing right now on smoke-free living. And for the students, what do you think of smoking? When you hear the word smoking, what do you think of?
Well, I think that if I hear the word smoking, it's really bad for everybody, and it will give them lung cancer and everything, and I feel sorry for people who has been lost for smoking. And I have basically a relative that want to quit smoking before he gets hurt or anything. And what do you think about smoking?
Well, when I hear the word smoking, I think of things, terrible things like cancer and the diseases that you can get from smoking cigarettes. And many people that do smoke, it's either that they don't know or that they do know, they just want to ignore it because they don't think it's a big deal. But what they don't see is that it is a big deal. It could change their life forever. There are some people that don't get the diseases, have no chance of getting them at all, but every person's different. So you never know if one cigarette can do damage for the entire body forever. Yeah, and how do you influence like your friends and your peers about quitting when you see someone do that? Like if I see someone do that, I'll just tell them the facts and everything so they could just learn, and I'll try to get them quit every day for my life, and finally to quit, I'll be happy and really excited. Okay, that's good. And Ms. Esposito, do you counsel only children or adults as well?
I'm a social worker, intervention counselor in the elementary schools in the Bronx. So I do primarily work with children from kindergarten to 8th grade. But in working in the project with Dante and Angelo, we did try to advocate for, you know, tobacco advertising to be different in the community, and that would also not only acknowledge youth in the community, but also adults in the community as well. Okay, so what is your message to the children? I think working with Dante and Angelo, we really kind of wanted to just promote an overall awareness to council members and advocacy groups and anyone who's really in charge, community board members, anyone who could really make a change in the community. So my message would be to really be aware of the tobacco advertising in the Bronx, so that you're aware of the fact that the more likely that they advertise, the more likely you are to begin smoking and even have an interest in trying smoking at a young age. So if you have that knowledge, you'll be less likely to ever engage in smoking.
And what are the ages that you deal with again?
I generally work with children from kindergarten to 8th grade.
And what would you say the grade, at what grade do you think that children begin getting more like involved in smoking or see it most?
I think that they're really experiencing peer pressure at later ages in 7th and 8th grade, but in a lot of the studies that we had reviewed in doing the project, it is actually a younger group of kids that are being exposed to cigarettes and peer pressure. I would say the average age now is probably around 5th grade.
5th grade? And where do you think they get that? Is it from what they see when they walk to the street, when they walk to school, or do you think it's from their house?
I think it's a mixture of everything. I do think that they're overly exposed by tobacco advertising when it is at bus stops or delis or anywhere in the community. And I do think that if you're seeing that at home and you're seeing it amongst your peers, and in addition to that into community, then it really is, you know, you're being exposed in every outlet as in the community.
Okay. And so how do you guys work together? As in like in a project?
I met with the boys for 6 weeks after school, and each week we developed a different goal that we were going to set for the project. One week we interviewed local deli owners in the neighborhood to see what they thought about tobacco advertising. We learned a little bit about tobacco legislation, how they actually get rewards, so to speak, for advertising in their deli. And then we tried to come up with an idea of how we can use all the knowledge that we gained from interviewing deli owners to then promote the awareness to the kids. So Dante and Angelo came up with the idea they really wanted to create like a news skit where the kids can come see them present the interviews that they had done and what their research had found.
Do you guys know the news skit by heart?
No.
A little piece?
Yeah.
No? Okay. Well, one thing that was interesting was that I also found out that pharmacies promote smoking. How do you guys feel about that? Oh, what is your action towards that?
Well, the pharmacy that we interviewed didn't. They were actually against any tobacco advertising. They had only advertised like a nicotine patch and anything that would really encourage you to quit. But in other areas of the Bronx, we did find that local pharmacies were like selling cigarettes. So I'm sure you guys would like to share on that, because Dante and Angelo were very surprised to see that the local pharmacies were advertising tobacco, given that their whole establishment is for health and, you know, getting you to feel better.
So what did you guys think about that? What was your impression?
Well, I thought it was as actually one of the pharmacists that we interviewed. I agree with him. He said that he said that I think that it was counterproductive, because if you're a pharmacy and you're trying to promote not smoking and you're trying to sell items that'll help people quit, then why would you display your cigarettes in a way that everybody can see it and then they're going to buy these cigarettes? It's not helping at all.
Your reaction?
Well, mostly even sometimes when kids try to get the medicine or anything, and basically they see people smoking, they want to maybe try, and if they like the taste, they'll keep on buying it secretly or something, or stealing it, and like liking it a lot, like addicting, like for example, video games, let's say.
Something that happened today, I'm old enough to remember the 1964 Surgeon General's report, which is the first report that linked tobacco use to cancer. And every Surgeon General report since then has talked to some extent about tobacco use. The Surgeon General had her press conference today and introduced the 2012 Surgeon General's report, and it was all related to what these young men are talking about, the huge impact that tobacco advertising has on youth. We may walk into a deli or bodega or grocery store, and as an adult, it just is sort of part of the wallpaper. We don't even notice tobacco advertising and tobacco products anymore. But the young people do, and the tobacco industry, you know, knows that they're next generation of smokers. Something she said today that I thought was amazing. We all know that 90% of smokers begin before age 18. So these two young men, unfortunately, are their targets. But she said 1,200 smokers die every day from tobacco use. Big Tobacco knows that our youth are their replacements. Every tobacco-related death is replaced by 2 new smokers under the age of 25. So where are new smokers going to come from? The tobacco industry would go out of business, which would be wonderful if it weren't for their targeting young people like this. So it's still a major issue, and I'm glad the Surgeon General continues to bring it up every year.
And do you also deal with other issues, issues such as alcohol and like physical abuse, or is it just tobacco?
We're just working with tobacco, but ADAP, of course, works with substance abuse, and including alcohol, and they've been just an amazing partner because it is so easy to connect all those issues. So that's why we reach out.
So you guys are also involved in alcohol, as in prevention?
In the school system, they are. When ADAP is, placed in a school, they do outreach as far as educating the kids on alcohol and tobacco use and drug use. And then we also have lesson plans with them. We also provide group therapy if there is a student who has a family member that may use. So we really do provide a few different services that really relate to any alcohol, tobacco, and drug use.
How is group therapy?
It really varies on the topic, but if there was a group of students that tend to have users in the family, then the group therapy model would be about really encouraging them to not go down that path as well, and also try to work with that family member and how they can really, just kind of cope with it. But it depends on the group therapy model that we're using and what the subject is.
As in parents coming in?
We do workshops with parents, but we don't provide therapy for the parents. It's really just for the children.
Oh, okay. So what advice do you have for other kids?
Well, for other kids, I'll say don't smoke and try to stay sober and don't drink alcohol or anything because it's really bad for you, and a lot of health problems could happen and you might die. And I don't want to see like other boys or girls or any other kids do that until maybe like the legal age. And I want to try maybe at least like rising up the age for alcohol. And
do you know the legal age?
Right. For smoking, it's 18, and alcohol is like 21, I think. And we should like raise that up a little bit because our body will not stop maturing by then either.
Okay, that's interesting. All right, so where can we get more information?
You can call the Bronx Smoke-Free Partnership. We have a website, which is www.bronxsmoke-free-partnership.org, and I'm happy to give my phone number, 718-466-8857. Please call anytime. We'd love to give you more information. I mean, I think a lot of people unfortunately think that the tobacco issue has been solved, and it has by no means. 151,000 people still smoke in the Bronx every day. It's a lot of people, and if you put that in terms of youth, 3,000 youth in the Bronx still smoke, and 1,000 of those will die prematurely if we don't prevent them from smoking or get them to stop smoking. So it's still a major issue. I just can't imagine 1,000 of these young men dying prematurely when they don't need to.
And where can we get more information from you? Are you just only in the school?
No.
Or do you also do outside counseling?
We do have outside counseling as well. It's at ADAP, the Archdiocese Drug Abuse Prevention Program. We're located in the Bronx, and you can also reach us at 718-904-1333. And we do have a website as well.